I love that.
All right. Welcome. Thank you for joining us at the October Health Equity Forum. A few quick reminders if you're joining us online. We ask that you please put your name in the chat for us and let us know what organization you're representing, where you're joining us from. A note that the meeting will be recorded. If you have any comments or questions, please use that chat feature. We will be monitoring it. And for in-person and virtual attendees, when you have a comment to make or a question to ask, please let us know your name, your organization, so that we know who we're talking to. And we encourage your reactions. So thanks for coming, and I'll turn it over to Karina.
Thank you so much, Wendy. Welcome, everyone. My name is Karina Limerick, and I am the program manager for the Health Equity and Racial Justice Office. We are so glad that you have joined our Health Equity Forum for this afternoon. We have a wonderful topic in store for you today. We'll be talking about disability inclusion, and we have a lineup of experts who will be sharing with you the work that they do. So really excited about their topics for today. But before we dive in, we want to start with just an update from our health officer, Dr. Tony Gettin.
Thank you. Move to the next slide. Not because I'm uncomfortable with my face on the screen every time I'm here. I appreciate it though. But it is flu season, and I actually don't know what to call this season anymore, because we used to say cold and flu, and now it feels like cold, flu, and COVID. So how do we actually address this season? But what does that mean, and what are we encouraging people to do as far as vaccinations are concerned? And it's really threefold. But today I want to focus on flu vaccines, and this is one that everybody's been really familiar with for years. Nothing has changed. We still encourage everyone over 6 months old to get annual flu vaccine, and now is the time. And so what are the best ways to protect yourself along with being vaccinated? Making sure that you're covering coughs and sneezes, washing your hands, all the things that we have emphasized over the last few years to cut down wiping surfaces, etc., to cut down on the spread of infectious diseases. Next slide, please. And so how do you go about getting vaccinated? There's a couple of different ways. We do hold health department clinics, and we are really focused on our vulnerable population. So we do a good deal of things with seniors and focusing on them. Also children, we've always been able to vaccinate them through the Vaccine for Children's program. So uninsured kids in particular coming to the health department. We do have some initiatives with our Title I schools to provide flu myths in schools for children, and those consents have gone out and families have signed up for that. But also talking to your medical provider and your local pharmacy. Those are really easy ways to get in and get your vaccines done. You can get your flu and COVID vaccine at the same time. You can also get your flu, COVID, and RSV at the same time if you are over 60 years old. And so we're encouraging everyone this season to make sure that they're getting their flu vaccine, but also making sure that folks are getting their COVID vaccine if you are over 60, looking at getting your RSV vaccine, or if you have a child that is under 8 months old. RSV vaccines are also very important, and all of these illnesses, respiratory illnesses, have very similar symptoms. So you're going to see coughs, fevers, runny noses, a lot of these things. There are differences in them, but they can be very difficult to tell apart. So we want to make sure folks are vaccinated. And then also not just children that are newborns to 8 months old, but if you have children between 8 months and 18 months who have conditions that may make them high risk or immunocompromised, please talk to your provider about those children receiving the RSV vaccine as well. But there's some numbers at the bottom of the screen. If you want to schedule an appointment or talk to our staff about how to get vaccinated at the Glen Burnie Health Center or the Lowell Health Center, and you can also visit our website at aahealth.org, and the information is there about when clinics are held. So we do encourage everyone, please come out, get vaccinated. And it is the most effective way, and you may still, make sure we tell everybody that the vaccine does not mean that you may not contract it, but hopefully it will stop it from being severe or that you will be hospitalized and will minimize your symptoms. So please do get vaccinated this week.
Thank you so much. Prevention is key. Sure. So today's forum, we're going to be focusing in on disability inclusion. This month is National Disability Employment Awareness Month, and we're celebrating 50 years of this Rehabilitation Act of 1973. And the theme for this month is advancing access and equity. When we look at someone, we do not see all of who they are. So I really just want to frame our conversation today with a really short video focusing in on 9 different individuals who will be sharing their story. It's a very short video, but again, it really spotlights the importance of disability inclusion.
I'm 5'11".
Barely 5'4".
I weigh about 170 pounds.
Brown eyes.
Blue eyes.
Brown hair.
Gray hair.
I'm a baseball fanatic.
I'm a wife.
A mom. A sister.
And a grandfather.
I'm a bodybuilder.
I'm a research analyst.
Small business owner.
Teacher.
Dance fitness instructor.
Film and television actor.
I'm an office clerk.
I'm a copywriter.
I'm a veteran.
I have a prosthetic leg.
I have multiple sclerosis,
I have lupus.
Cerebral palsy.
post-traumatic stress disorder.
I'm blind.
And I'm working in a job I love.
I love.
Because I was given a chance.
Because I was given a chance.
To contribute my skills and talents.
To show my disability is only one part of who I am.
Who I am.
Who I am.
At work, it's what people can do that matters.
For more information, visit whatcanyoudocampaign.org.
Very much. So I hope you got a sense of the different stories that the individuals in the video have shared about who they are and the different cultural identities that they embrace and how they show up every day in jobs that they love. So we're going to continue the conversation around disability inclusion. And we are joined by Carissa Kelly. She is a passionate advocate and professional with over 28 years of experience in aging and disabilities. And she currently serves as the director of the Department of Aging and Disabilities right here in Anne Arundel County. Carissa has supported older adults, children, and adults with disabilities, as well as family members and caregivers in an array of environments in both the public and private sector. She's directed programs in schools, residential facilities, day programs, healthcare systems, county governments, and employment programs for older adults and adults with disabilities. Some of her accomplishments include implementing the first adult high-intensity day support program in the state of Virginia and designing and implementing a multi-generational and ability-integrated employment program in the state of Ohio. In her tenure at the Department of Aging and Disabilities, she developed successful programs to integrate social and clinical services, having an exceptional impact on population health. Most recently, Carissa was elected as the secretary of the Maryland Association for Area Agencies on Aging. She continues to dedicate herself to the residents of our county by promoting health and well-being through innovative programs and services offered through the mission of the Anne Arundel County Department of Aging and Disabilities. So we want to give a warm welcome to Carissa Kelly.
All right. Good afternoon. You have my presentation. All right, so good afternoon. Again, Carissa Kelly, Director of the Anne Arundel County Department of Aging and Disabilities. The Department of Aging and Disabilities, we serve older adults, individuals with disabilities, caregivers, veterans, and really anyone interested in planning for their future. We do so through 23 programs in 25 locations throughout Anne Arundel County. Next slide. So I'm not going to go through 23 programs, but we'll today have a disability focus. So we have 3 divisions really at the department. And if you could just go back a slide. We have our first division is the Aging and Disability Resource Center. And all of the programs in this division are focused on the alignment of resources to empower individuals through self-determination and really are focused at initial line of support and working with individuals on a sustainable plan. The long-term care division is really a misnomer. The programs and services within this division are focused on having individuals, empowering individuals to remain in a community-based setting and to avoid institutions. To the left of the screen, you'll see we publish each year an Anne Arundel County directory. This is a directory of resources and services, not just within county government, but with community partners, agencies, nonprofit entities, businesses that support individuals with disabilities. We publish about 55,000 of these every year, and they're available in both English and Spanish, and we're currently working on a Korean translation. Next slide, please. So the third division is really a disability and community services division. This houses our ADA coordinator for Olive County government, making sure that programs, services, and the 136 public-facing government buildings are accessible to the disability community. And we do this through the federal enabling legislation of the Americans with Disabilities Act of 1990. As previously mentioned, October is Disability Employment Awareness Month. And we also celebrate this each year in the month of October through hosting a signature event, 2023 Disability Awareness Day. Our theme this year is Advancing Access and Equity, quite themed with the focus of today's presentation. But I definitely would love everyone, if you could, to come out. We hold it at the Annapolis Mall this Saturday, October 28th from 10 to 12. And this day is really about focusing in on businesses that employ and empower individuals with disabilities. We also celebrate each year an honoree. And we celebrate nonprofit entities that support individuals with disabilities. This event is also well attended by a host of different service organizations that offer resources and supports to individuals with disabilities. Next slide. So statistics for our county. 7.2 residents under the age of 65 identify as having a disability, which is about 43,000 residents within county. 16.2 identify over the age of 65, which is about 1/6 of our total population. But of course, as with anything, these statistics are really underreported. As a lot of individuals don't identify as having a disability. And there are other concerns about reporting. Next slide. So I really just wanted to highlight out of the 22 programs, what programs help advance equity and access for individuals with disabilities. So we are, as there are 17 other Maryland access points within the county or within the state of Maryland. And Maryland Access Point is really a no wrong door philosophy. So an individual with disabilities can gain access to services and supports through coming into one of our 2 customer service centers within the county. The first northern point of customer service is at 7320 Ritchie Highway in Glen Burnie by the Empire Towers. And the second is in the Heritage Complex on the 2nd floor. where individuals with disabilities are invited to either make an appointment or they can come in unannounced and without an appointment. And they won't have to wait all day for services because it can be challenging enough navigating out transportation, figuring out what you need, where you need to go. So individuals are welcome to walk in Monday through Friday, 8 to 4:30, and they'll be able to meet with a resource navigator just to discuss what options are available to them, help complete benefit paperwork, which can be insurmountable, and really kind of guide them through a navigation of resources that is self-determined by the individual. We have resource navigators that are fluent in Spanish and Korean available to the community, just to decrease any equity barrier that's out there. We also have the ability to use Sign Language USA for individuals who have hearing impairment. And we also have resources for individuals with low vision to make the touch point of service successful. We also work with, I think, what is your next speaker, Accessible Resources for Independence. We're co-located at the Department of Aging and Disabilities, and we have a housing specialist which works with the community, the disability community, on housing options, which we know is problematic and challenging for our entire community, let alone if you have a disability and need accessible housing. So we're proud to partner and co-locate with Accessible Resources for Independence. We also house our Americans with Disabilities Act office. And again, that coordinator ensures compliance for all of county government to make sure that there's access to programs, services, and even our public facing buildings. We also work with Asha Smith for fair housing, and our offices combine and work together to resolve any housing issues, parking issues for individuals with disabilities. New to the department, I would say in the past 2 years, is our assistive technology loan program. And this is truly great. Post-COVID, we were able to obtain a grant to purchase devices, adaptive devices, to help improve and increase independence with mobility, communications. We have adaptive equipment for any kind of communication, telecommunication, that you can go in and by appointment at any time. You can try out a piece of equipment. And this is truly great for individuals with disabilities because, you go out there, you think that you've got an item that's going to enhance your independence. You purchase it, and largely these are very expensive items. And then you determine that after your insurance has covered the cost, that it's not the most appropriate device for you. And there would be a different device that, if just changed a little bit, would be able to advance, your ability to be included. So what's nice is you can go to the lending library, you can try out a piece of equipment for 30 days. And if you, at the end of the 30 days, found that it enhanced your independence, we will actually work with you to obtain a grant so that you can purchase your own device, which is really nice. This is available to any county residents, and I will also highlight it's also available to county government employees to really make them successful in their employment if they have a disability. Our Commission on Disability Issues, so appointed under the county executive. Oh, no, it is not based on income for the grant. The grant is open to anyone, and we will help you obtain a device. I just saw that in the chat. Absolutely. The Commission on Disability Issues, appointed through the county executive, is housed at the Department of Aging and Disabilities, and this is a group of many different commission members that all have a different angle on either working with individuals with disabilities or having a disability themselves. And this is an advocacy group that meets monthly to determine ways in which we can be a more inclusive government. Our caregiver support program. The majority of Anne Arundel County caregivers are working full-time jobs, have families, and are caring for an individual with disabilities. So if it wasn't challenging enough. So what this program does is it offers caregiver support group programs, education and training on how to care for an individual with a disability. This program also offers a grant. It is the easiest grant, no red tape to apply for, and I'm always astonished at how many people don't. It's one piece of paper. You just need to be a caregiver caring for an individual with a disability, and it's $500. You simply fill out the piece of paper. It's non-income asset contingent. The piece of paper goes in a drawer of my program director of that National Family Caregiver Support Programs, simply so we can contact you and make you aware that the grant cycle is open for the following year. So again, a piece of paper, we mail you a check for $500 2 weeks later. And we don't ask any questions, and it doesn't get reported on any federal government website. It's just something available to caregivers. Transportation, we know this is an issue for everyone, older adults, disability alike. So we do offer discounted taxi voucher coupons for individuals 55 and older, or 18 and older with a disability. And we do have adaptive vehicles within the county that we partner with that have access to ramps and can transport individuals who use a wheelchair for mobility. So this program, you can come into one of our 2 customer service centers. And you can purchase, arrange an amount of booklets. So let's say you purchased $50 worth of booklets, it would give you $100 in taxi and transportation services. And that program is also not income and asset dependent. We also are a supports planning agency for the 5 waiver programs, or the Medicaid waiver programs in Anne Arundel County. A supports planner is much like a case manager, only putting really the person first. So they're just a guide, if you will. When an individual receives a Medicaid waiver or a funding bank, and we help them decide and plan on in-home services that best meet their needs. And this is fully directed by the individual with disabilities and what they want to live independently in a community-based setting. Respite care program. This is another program that I would like to highlight. You know that we have a lot of private sector home health agencies, and they can charge upwards of $50 to $75 an hour, making it really difficult to get all of your needs met if you're an individual with disability, and remain independent in your home in place of long-term care. So what we do at the Department of Aging and Disabilities was we maintain a background checked registry of in-home providers that charge between $17 and $22 an hour. And the contract is between the care worker and the individual with disabilities. We provide direct, and ongoing training to these care providers. And we also, some companies background check once. We make sure we do it annually to keep our community safe. So it's really a lower cost alternative to in-home care, where the individual with disability doesn't have to sacrifice really their personal care needs and chore service needs, as they would with a higher cost home health agency, where they would have to decide between services. So it really is a lower cost alternative for them. Our telephone reassurance program, this is not a robocall. We maintain a bank of volunteers that come into the department on a daily basis, 7 days a week. And they do well checks on individuals to make sure that they haven't fallen, that they're not answering because there's a medical emergency. And we follow a protocol of contacting, next of kin if we don't hear from the individual. And then, of course, if we don't hear from them, following up with a police well check. But really more than a safety measure, this program has become a means of socialization. I hear sometimes the volunteers outside of my office, and they'll be on the phone for 45 minutes talking about, visiting a relative and, who came to visit and what activity they did. So it really is a safety and a socialization program. Our mobile integrated community health program, this is a excellent where we at individuals who were high utilizers of emergency care and 911 systems. We developed a program where paramedics from Chief Wolford's program go out with social workers and nurses from my program, and they really go into homes and wrap services around individuals. An example is maybe an individual with disability that utilizes a wheelchair was, needing repositioned or couldn't assist themselves from their wheelchair to their bed or to their shower, and they were calling 911 to do so. Our team, our MIC team is what we call them. We go in and we decide, let's wrap in a bariatric Hoyer lift, or let's place some adaptive equipment. Let's put in some touch point services. And it really has empowered individuals and decreased utilization of 911 systems. And then we also maintain your local Medicare, Medicaid office. It can be daunting to figure out your benefits. This program sees individuals in person and can navigate out prescription plans by appointment or by walk-in. It might be a little difficult to walk in right now because we're in Medicare open enrollment. But in 3 months last year, we assisted 3,000 individuals with a tiny team of 2 and some wonderful volunteers. We also work with Assistive Home Medical. This is a nonprofit, an area nonprofit. They have an occupational therapist that can kind of go out to your home, determine what you need, and they have free equipment. So whether you need a wheelchair or a walker or adaptive equipment. And what I really like about working with this nonprofit is, in place of, another agency where they may hand out a free walker, it might not be appropriate for the height and the weight and the mobility level of the individual. So they have an occupational therapist that can truly clinically measure all of those things to make sure that you get the right and most appropriate piece of equipment to maintain your independence. And then also newly, we developed our Veteran Services Coordination Center, where we work with veterans to obtain their benefits, their disability ratings, any kind of supportive technology, and anything that can help a veteran remain in their home for as long as possible. Next slide. In closing, looking at health equity and access, some of the challenges that we experience, Whether it is something that was planned or unplanned, we do find architectural barriers to access physician and community healthcare offices. Sometimes we'll see a curb cut, nowhere near the disability parking. We deal with a lot of parking lot striping that doesn't offer enough access to individuals with disabilities. Or the access aisle isn't large enough or isn't appropriately striped next to a ramp. Building access, you can get all the way there and you can park, but opening heavy doors, crossing thresholds, both in standard mobility and in a wheelchair, are really, really very much still barriers within Anne Arundel County. A lot of the services we know that attendant needs to come with the individual to support them for medical procedures like MRIs and CAT scans. If the individual needs behavioral assistance or even mobility transfer assistance, and that is in and of itself a barrier for an individual with disability. Back to transportation, we realize that's a need and a barrier for a lot of individuals, not just in Anne Arundel County or in Maryland, but this is a national and systemic issue. And then also, I think it's really important to highlight and recognize that there is no local level funding or resources for individuals with disabilities. So we know very much that the DDA chiefly handles services and service coordination for individuals with disabilities, but there is no local disability office. So making it a little bit more of a barrier to access, local services and supports. And I haven't been paying attention to all the questions. So I guess I can go to the chat if that's appropriate now.
Yes.
I think a lot of it that I addressed is not income and asset contingent. That's a question about the grant. Obviously for Medicaid waiver, you have to apply for that and be awarded through federal Medicaid. So that would be the one exception to the list of programs and services that I had highlighted. More information on the monthly advocacy group. So the Commission on Disability Issues is an open and public meeting, and the meeting dates are listed on the Department of Aging and Disability website. We're always looking for members. So if it's something of interest to you, you could submit your resume and background and application to the County Executive's Office. But again, with open meetings, we also accept ex officios and encourage public participation. For the $500 grant, referring to the caregiver grant, must you be documented to receive? I'm not really sure I understand that question. I'm thinking I might. And the way that I would answer that is that there is no proof of residency or citizenship. And again, that form doesn't climb to state or federal levels, but is maintained in the drawer of one woman named Mary Chappitt, and she's my director of National Family Caregiver Program. And again, she just uses it so that she can add the person to their email list to let them know when it's yet annually available. And I think that's it, unless I've missed something. Are there any other questions? All right, well, it was definitely a delight and a definite passion of mine to speak with you all today. And I see all the partners, within this group, and I thank all of you for your partnership.
Thank you so much, Carissa. We really appreciate Appreciate it. You're highlighting all of the incredible programs at the Department of Aging and Disabilities. I saw a lot of note-taking happening in the room, so I imagine that there's great interest in the work and hopefully a commitment also to spreading the word about the wonderful programs, especially the ones that are not income and asset dependent, just kind of spreading the message that those programs are available right here in Anne Arundel County. Thank you so much. Our next speaker is Erin Ashinghurst, and she is the Deputy Director of Programs and Services at Accessible Resources for Independence Center for Independent Living. She's an advocate and professional with a mission to promote disability community interests within the field of health and human services. She's worked to build local and statewide coalitions to develop disability inclusion trainings, toolkits, and publications aimed at a public health audience. She's credited as second author on the 2018 Maryland Birthright Surveillance Brief entitled Disability and Health Among Maryland Adults. We're so happy to have you, Erin. Thank you so much for joining us.
Thank you so much for welcoming me today and for offering to advance the slides for me. I had hoped to be there in person, but had a little bit of a snafu with transportation. So thank you again. We can go ahead and advance the slides. And once again, we can advance the slides. And once again, we can advance the slides. Okay, wonderful. I wanted to share a bit about Accessible Resources for Independence. If you're not aware, ARI is the Center for Independent Living, reaching people with disabilities in Anne Arundel and Howard County, Maryland. And as a Center for Independent Living, or CIL, we're consumer-controlled, community-based, cross-disability, non-residential nonprofit agencies led by people with disabilities. So we aim to strengthen our disability advocacy network by providing information and services that empowers our community. Next slide. And we're guided in everything that we do by the independent living philosophy, which was really ignited by a movement of people in the civil rights era, people with disabilities who work for self-determination and equal opportunities and respect for people with disabilities. And it's really, the core principle is that people with disabilities have the same basic human rights as those without disabilities to participate in and contribute to community life. Next slide, please. So what is disability? There are several definitions of disability and theories about the definitions of disability, but Centers for Independent Living use the Rehabilitation Act of 1973. And under that act, a person with a disability is defined as someone who, one, has a physical or mental impairment that substantially limits one or more major life activities, and two, has a record of impairment, or three, is regarded as having such an impairment. And most of the disability prevalence data within the state of Maryland comes from the Disability Health Data System. And I'll talk a little bit more about some of the data and the data collection standards in a bit. We can go to the, oh, and I did also want to mention, although we all know as well that there are many different types of disabilities, which I'll talk about, and that some disabilities are visibly apparent, but some are hidden or not easy to observe. Next slide. And also there are 3 dimensions of disability according to the World Health Organization. So there's the element of impairment within a person's body structure or function, or it could be mental functioning. And examples of this could be a loss of limb, loss of vision, or memory loss. Then there's activity limitations, which examples could include difficulty seeing, difficulty hearing, walking, or issues with problem solving. And then there's also the element of participation restrictions in normal daily activities, such as working, engaging in social and recreational activities, or obtaining healthcare and preventative services. So we can advance to the next slide. So again, the data for disabilities, especially relating to health and wellness, there are some standards set forth by the Health and Human Services Department. And those guidelines are called the Implementation Guidance for Data Collection Standards on Race, Ethnicity, Sex, Primary Language, and Disability Status. That's the last component there. So some of the data that we have available statewide in Maryland asks 6 core questions around disability as a standardized way of gauging, does a person have a disability and what type of disability? So those 6 questions are you deaf or do you have serious difficulty hearing? Are you blind or do you have serious difficulty seeing even when wearing glasses? Because of physical, mental, or emotional condition, do you have serious difficulty concentrating, remembering, or making decisions? Do you have serious difficulty walking or climbing stairs? And do you have difficulty with dressing or bathing? And lastly, because of physical, mental, or emotional condition, do you have difficulty doing errands alone, such as visiting a doctor's office or shopping? So if someone answers yes to one or more of those questions, then they would be considered to have a disability. Next slide. And I know that we had highlighted some of the local disability data, but disability really impacts all of us. Statewide, 1 in 5 non-institutional, so community living adults in Maryland has some type of disability, and that's those who report it. So again, it's going to be underreported oftentimes. And people with disabilities experience significant health disparities. Adults with any type of disability in Maryland were more likely to report not being able to see a doctor within the last year or 12 months due to cost. So that's one example of a disparity. Next slide. Some other data points. In Maryland, over 72% of adults with disabilities having a chronic disease, reported having a chronic disease such as diabetes, hypertension, or kidney disease. And Maryland adults with disabilities also report higher rates of depressive conditions, tobacco use, and high weight than people without disabilities. And it's noted, as most of us know, that people who smoke are more likely to report difficulty maintaining health. Next slide. So this audience is well aware of health equity, but health equity is achieved when every person can attain their full health potential and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Next slide. And what does health disparity mean? So we're all on the same page. Health disparities are inequitable and are directly related to the historical and current unequal distribution of social, political, and economic or environmental resources. Next slide. And the COVID-19 pandemic has really brought some much needed attention to the avoidable health disparities that predate the pandemic. The overdue examination of disparities really needs to include health disparities that exist between people with disabilities and non-disabled people, which are even more pronounced among racial and ethnic minorities. So Barbara or Bobby Lynn, who is a disability activist, said, unless you pay attention to people with disabilities from the outset in rethinking solutions, you're going to perpetuate long-standing disparities among people with disabilities, including those who are racial and ethnic minorities. Next slide. So nearly everyone faces hardships and difficulties at one time or another. But for people with disabilities, those barriers can be more frequent and have an even greater impact on our health. And the World Health Organization describes barriers as being more than just those physical obstacles, but also factors in a person's environment that through their absence or presence limit the functioning and create disability. And those aspects can include physical and environmental areas that are not accessible. It can include a lack of useful assistive technology. It also includes attitudinal barriers, such as negative attitudes of people towards disability, as well as services, systems, and policies that either are non-existent or that hinder the involvement of people with disabilities or health conditions. Next slide, please. So how do we address access barriers, or what things are in place to address some of these access barriers? Many of us are also aware of some of the healthcare access laws, including what was referenced before, the Americans with Disabilities Act and the Section 504 Rehabilitation Act, which both require that healthcare providers and individuals with disabilities have full and equal access to their healthcare services and facilities. And then there's Title II of the ADA, which applies to public hospitals, clinics, and healthcare services operated by state and local governments. And Title III of the ADA applies to privately owned and operated hospitals and clinics and healthcare providers. And then the Section 504 Rehabilitation Act really applies to recipients of federal financial assistance, such as Medicaid and federally conducted programs. And reasonable accommodations are really any modification or adjustment to a setting, such as a job or work environment or a program that enables a person to, with a disability, to perform the essential functions and to participate in that program or that job. And then disability inclusion is really making sure that everyone has the same opportunities to participate in every aspect of life. It's very much aligned with the independent living philosophy. Inclusion allows for people with disabilities to take advantage of the benefits of the same health promotion and prevention activities experienced by people who do not have disabilities. And those could include things like education and counseling programs that promote physical activity or improve nutrition or reduce the use of tobacco, alcohol, or other drugs, as well as blood pressure and cholesterol assessment during an annual health exam or screenings for illnesses such as cancer, diabetes, and heart disease. Next slide. And we can actually advance to the next one as well. So many of us have heard tell of principles of universal design, and we don't have time to do a deep dive here, but I wanted to highlight some of those principles today very briefly. So the first is equitable use, essentially making sure that the program service is useful to people with diverse backgrounds, including people with disabilities. So there's an element of disability cultural competency, flexibility in use. So accommodating a wide range of individual preferences and abilities. The information should be perceptible. So we want to communicate effectively, use necessary information to the user, regardless of that individual's condition or disability. Next slide, please. Also having a tolerance of error. So generally minimizing the hazards or the negative consequences of accidental or actual unintentioned actions. And then low physical effort, being efficiently used and in a comfortable manner with minimal amount of fatigue involved. Intuitive programs, the use and design is easily understood, it's clear, uncomplicated, And then lastly, having size and space for approach and use. Okay, next slide. General recommendations for community messaging in public health that we can all adopt and consider is to learn about disability rights and the independent living movement, to get to know people with disabilities, to address biased thinking by basically considering things like stigma, ableism, and discrimination, and other types of access barriers. Avoiding using confusing language and medical jargon by using plain language instead. Encouraging helpful steps to improve overall health while also acknowledging the existing systemic health access barriers. Considering alternate methods to nutrition instruction and physical activity instruction. For example, in meal preparation and cooking, incorporating the use of a microwave, adaptive kitchen tool, having someone else shop for an individual, etc. And then also including diverse images, including images of people with all different types of disabilities, and keeping in mind that many disabilities are visibly apparent, but some are not. Next slide, please. And then there's also the, I guess, philosophy of health at every size, which many people with disabilities kind of, I guess, agree with because it's philosophically aligned. But basically, Hayes affirms a holistic definition of health, which cannot be characterized by the absence of physical or mental illness or limitation or disease, but rather it says that health exists on a continuum that varies with time and circumstance for each individual, and that health should be conceived as a resource or a capacity available to all, regardless of health condition, disability, and it's not an outcome or objective of living. It's not, pursuing health is neither a moral imperative nor an individual obligation. And health status should never be used to judge, oppress, or determine the value of an individual. Next slide. I know we're very limited time, but if you want to click twice, there's some questions for consideration, which I had for the group, which is what disability and health data does the county currently collect? And also what training resources does the county promote to improve professional awareness of disability cultural competency? So I don't know if we'll have the answers right now on the spot, but things that are important for us to consider. And then next slide. I did want to also mention in one of the other local counties, our organization, ARI, has done some disability and health awareness campaigns to do things like promote tobacco and chronic disease intervention programs that already exist among people with disabilities, and also to inform people with disabilities about free and low-cost community-based wellness services, some of which we put on as an organization, and also to directly refer people to those resources that would generally improve their health and quality of life when they were looking for those resources. And then you can advance again, and I think once more actually. I wanted to mention some other resources that exist for public health professionals. There is an accessibility and accommodations on disability and health toolkit, which was developed by the statewide disability and health inclusion program quite a few years ago. And the website is linked here and will be in the slides for that toolkit. And I guess we can go ahead and advance slides once more. Additionally, there's the National Center on Health, Physical Activity and Disability, also called NCPAD, and they put out the NICEP, which is the Inclusive Community Integration Process, which is, I believe, a 12-step scientific program to move through as an organization how to increase the disability inclusion of a program or service. And then there's also the Job Accommodations Network, which puts out a lot of great resources about different types of accommodations that a person with a disability might utilize or benefit from on the job. And then Accessible Resources for Independence does also have a few assistive technology programs as well. Don't think I have time to get into them today, but generally, I just wanted to thank everyone for your time today. And if we do have time to address those questions, or if there are other questions, I'm happy to address them now.
Thank you, Erin. Really appreciated your comprehensive overview. We will certainly share these slides with the participants. And if you do have questions, we invite you to type your questions into the chat. You can also send your questions to healthequity@aacounty.org. In the interest of time, we would like to continue on. We just have 2 announcements for you, and I think that they are quite important information to share with you. So if you will just hang in with us, we will get you out in the next 5 minutes. We'll conclude our forum for today. So I would like to turn your attention over to Mindy. She does have an update from the Healthy Anne Arundel Coalition for you regarding Find Help.
Thanks, Karina. So hi again, my name is Mindy Garrett, and I am the coordinator for the Healthy Anne Arundel Coalition. This is the local health improvement coalition for Anne Arundel County. And we have just contracted with a company called Find Help. You may be familiar with it under a previous name. It used to be called Aunt Bertha. And essentially, this is an online database that connects people to programs and services that they might need, and social services and programs. You can go to the next slide. This is the very simple process of finding a program through Find Help. You search by zip code. You can filter by the type of service or program that you're looking for, and you will find a listing with programs that fit your needs and all the information that you would need in order to connect with those programs. And just one more slide. So this is a sample page that I did just searching for disability programs. So I filtered by the zip code 21401 in Annapolis. I selected health as the category and health education, and I found 11 services available in the city of Annapolis. So this is a generic website. Once we have completed our contract with Find Help, you will be able to go to healthyannearundel.org, and we will have a custom page just to find these services, local services in the county.
Okay, well, thank you for the quick update. I also would like to share, and if you can advance a few slides here, maybe, for this next one, I want to just highlight the fact that our final Health Equity Forum for this year will be quite special. So this is a save the date. You will receive these slides. So we hope that you will share information about our final Health Equity Forum, which will be held on December 11th. Typically, our forums start at 3, but the time and location for this very special end of the year forum, to thank all of you for your support throughout this year. Those details are forthcoming, so do stay tuned. We hope that you will put it on your calendar and that you'll come out in person to connect with our office and to connect with fellow health equity champions right here in the county. At this time, I want to thank all of our presenters for today who have shared about disability inclusion. I learned some really useful information. I hope you did too, and that you'll share this information accordingly. Thank you all for joining. We do appreciate your support. Take care.